Hello everyone, today we're gonna study migraine and all the notes which I have made, everything is from Harrison only. So let's jump into the videos and I'm sure after watching this video you will be able to solve most of the questions from migraine. So migraine has three phases, one is premonitory, second is headache, third is post-op. So in premonitory phases we have yawning, tiredness, mood change, etc. Remember these phases is started in premonitory phase but it will continue till post-op. In headache phase, you will have nausea, photophobia, phonophobia, allodynia. In postdom, you will feel tired, lack of concentration, etc. So now let's come to the trigger. What are the triggers for migraine? You will have bright light, sound, other type of FM stimulation, hunger, stress, anxiety, like hormonal fluctuation during periods, barometric changes, alcohol withdrawal, etc. Important because if you understand pathogenesis, you can understand the treatment part. So in pathogenesis, in brainstem and hypothalamus, there is some sensory control system which get dysfunction in the migrainous people, and because of that we have sensory sensitivity. There is some cells in the trigeminal nucleus. Once this cell gets activated, it releases some peptide and particularly the CGRP. Because of this we get migraine, and some drugs have been made which antagonize this peptide. There is serotonin hypothesis, there is decreased serotonin in migraine people, and there is a dopaminic receptor hypersensitivity in migraine people. These all are the reason behind the migraine. Okay, so now let's come to the triptan and detan. What is the difference between triptan and detan? See, I have written here the most important point you needed for the exam. So triptan, what does triptan do? Triptan adds nerve signal in the trigeminal vascular system. Okay. Along with that, it also called cranial vasoconstriction, which detan doesn't do. Detan only adds the nerve signal. That's the difference between triptan and detan. Detan are more selective. Okay. Now comes to genetics. It's very important. Genetics are three types: FHM1, 2, and 3. Because of this mutation, we have this type of familial hemiplegic migraine. So, see, in type 1, we have calcium type voltage related channel. Here we get mutation in sodium potassium ATPase channel. Type 3 voltage gated sodium channel. How can we remember? 1 for 1, 2 for 2. Now how can we remember 3? C comes in alphabetically. C comes pale, after that S comes. No? So that means C will be 1, S will be 3. By this way you can remember the type. Now comes to the diagnostic part, the most important part. So for that you need 2 features from this and at least 1 from this. So we need 3 features to stamp a patient that he is a migraine patient. You will need unilateral pain. The pain character should be throbbing and pain aggravated by movement, and intensity will be moderate to severe. And along with that there can be nausea or vomiting, any of two. There can be photophobia and phonophobia. So we have understood the diagnosis part. Now come the midas. What is midas? The question of the midas you don't need to know. What you need to know I have written. The time cutoff here is 3 months. 4 grades are there. From grade 1 to grade 4, as we go down the severity increases. So if it is greater than 20 we have to use triptan, and till 20 we can use COX-1 inhibitor. Okay, like see, if 20 we can use COX-1 inhibitor, and if greater than 20 we have to use triptan. That's the thing. So I hope we all have understood the migraine. And now some 2 important point. What are the variant? One is ophthalmoplegic, one is retinal. Along with that there is so many other variant, but these 2 are very important for your exam point of view. Features are in ophthalmoplegic is rated to eye, but here we have third nerve palsy, and you can get ptosis and squint. In retinal you will have rated blindness and photo one. So here we have finished the topic migraine. Thank you for watching.